I want to welcome you to our webinar, Natural Solutions for the Treatment and Support of Peripheral Neuropathy. I also want to congratulate you for being here. The fact that you are listening to me right now means you are actively looking for a solution to your chronic pain. What I have found over the years is what people really want are the answers to two basic questions. Why do I have this condition, and what can be done to get my health back? First, I want you to know that you are not alone. This chronic disease affects millions of Americans. Essentially, it is a condition where the electric wiring is breaking down. The feet or hands don't communicate with the brain, or the brain does not communicate with the feet or hands. By definition, peripheral neuropathy means further out from the center of the body, away from the brain and spinal cord. Neuro means nerve, and pathy means abnormal. So, abnormal nerve away from the center of the body. There are 10 signs of peripheral neuropathy. You can have numbness, burning, cramping, sharp electric pains, pain when walking, sometimes a sensation that there are marbles under your feet, difficulty sleeping, tingling, loss of balance, weakness, and swelling. The symptoms depend on which nerves are affected. It can be the sensory, the motor, or the autonomic. In part, this is what makes it difficult for doctors to diagnose, because not only are there multiple causes, but many symptoms could arise depending on which nerve is affected. Damage to the sensory nerves can result in changes in sensation, burning, numbness, tingling, or an inability to determine joint position sense, which can cause balance issues. Generally, neuropathy will begin in the feet, but will gradually progress towards the center of the body. Damage to the motor fibers can cause movement difficulties, weakness, cramping, and even restless legs. Autonomic changes can cause swelling or discoloration, possible changes in blood pressure, pulse rate, or pupil dilation. The autonomic nerves go to the organs of the body, so things like digestion or even sleep can be affected. This next part is the most important part, so I want you to listen very carefully. It is what your doctors fail to explain to you the reason why you have chronic pain. All chronic health conditions have some common threads. There has to be an underlying component such as diabetes, anemia, autoimmunity, medication side effects, to name a few. This ultimately causes a neurological imbalance, causing a decreased firing of the brain and nervous system, and perhaps fatigue and degeneration will then set in. In our office, we always will see a combination of neurological and metabolic problems, and the ratio is slightly different for everyone. So I'm talking about metabolic. What is actually metabolism? How does this relate to neuropathy? When we eat food, our body converts this to energy. That's basically what metabolism is. And what system do you think takes up 30% of our energy? Is it the endocrine, the digestive, the nervous, the immune, or cardiovascular? Well, the answer, as hopefully you guessed, is the nervous system, our brain and spinal cord and nerves. We need proper metabolism, that is energy, for a well-functioning brain and peripheral nervous system. Metabolic problems and the body's inability to convert this energy leads to peripheral neuropathy. Let me introduce myself. My name is Dr. Michael Veselak. I've been a chiropractic physician for over 30 years, and I am board certified in integrative medicine and a certified functional medicine practitioner. I have a passion for helping people with neuropathy, as I unfortunately watched my father suffer before I had the answers. I have now dedicated my practice and recently have written a book, Feet Don't Fail Me Now, to help others and share what I have learned. We have successfully supported many patients with neuropathy, and we are hopefully going to share with you some of these important concepts that must be addressed. So first, let's talk about some of the leading causes of neuropathy, which I'm sure you're familiar with some of these. So the lower back issues, which can be the result of degenerative arthritis, spinal stenosis, disc bulges, or herniations, is one of the causes. Type 2 diabetes or insulin resistance is another common cause and probably the most well known. Chronic inflammation as well as nutrient deficiencies is what we have seen in the majority of our patients. This can range from food sensitivities, hidden infections, hormone imbalances, and then finally chemotherapy and statin drugs can be a contributor also to peripheral neuropathy. So stenosis, which is a narrowing of the spinal canal, degenerative or bulging discs, and degenerative arthritis have one thing in common. They all can compress the nerves in the lower spine, which is the sciatic nerve, which then can affect the feet. In our 6-week neuropathy recovery program, we will show you safe and effective stretches and stability exercises to increase the mobility of the lower lumbar spine to relieve pressure off these exiting nerves. The second cause, and again, the most documented of peripheral neuropathy in the literature, is diabetes and or insulin resistance. Nerves, as we discussed, need a lot of energy to survive. Glucose is the main source of the nerve's energy. Insulin is the hormone released from the pancreas that allows glucose to enter the cell and supply the brain and the nerves with energy. When you are diabetic or insulin resistant, the glucose cannot effectively enter the cell. This will lead to not only general fatigue and increase in fat and triglycerides, but will also lead to the nerves getting fatigued, which causes numbness, tingling, burning, pain, and or weakness. In our 6-week recovery program, we have guidelines for dietary recommendations to help control the blood glucose levels and decrease the inflammation in the body. Speaking of inflammation, this is one of the critical components that needs to be addressed if the peripheral neuropathy is going to improve. I love this saying, you cannot build a house if it's on fire, and it's the same that holds true with the body. Some of the common reasons for this inflammation are food sensitivity or inflammatory foods, hidden gut infections, poor diet, high insulin, hormone imbalances, and nutrient deficiencies. We recommend a paleo diet, which we discuss thoroughly in our 6-week recovery program. Proper supplementation is also critical to restore the proper nutrients that help support and regenerate the nerves. After treating thousands of patients over the years, we have endorsed a product called Nerve Revive. It is a special formula which has clinically proven ingredients for nerve support. At times, depending on the symptoms and severity, we might recommend a few other supplements along with the Nerve Revive. We have a Facebook Neuropathy Pain Support Group page to discuss the fine-tuning of this program with our patients. Another common cause of peripheral neuropathy is the use of statin drugs and or chemotherapy. So it's important that if you're taking statin drugs that you supplement with CoQ10 because statin drugs will inhibit the formation of this important enzyme. And CoQ10 is necessary for nerves to function properly. So, as we discussed, statin drugs can affect the nerves. They did a study in May of 2002 in the Journal of Neurology, and this study basically said that taking statin drugs increases your risk of peripheral neuropathy by 16 times which is equivalent to 1,600%. If we address the metabolic causes, then we have a good chance of winning the battle against peripheral neuropathy. So things like high blood sugar, anemia, liver congestion due to poor diet and or alcohol consumption. And then we need proper elimination through the kidneys and bowels. So these metabolic causes must be addressed, which unfortunately doesn't happen too often. Have you been told by your doctor that your labs are normal, but you still feel tired or have acid reflux, don't sleep well, and your feet still bother you? We approach labs slightly different. We approach them from a functional medicine perspective. We're trying to address the cause and not just treat the symptoms. We do this by tightening the ranges of your lab values. For instance, a normal fasting blood glucose target range for an individual without diabetes, and this comes from the Diabetes Association, they recommend a fasting plasma glucose of 70 to 130. Functional ranges are much tighter. We like the ranges of glucose to be between 85 and 100. So what exactly does a neuron need to repair and revive? For a neuron to regenerate and repair, it must require two things: fuel in the form of glucose and oxygen. And again, if you have inflammation in the body, you must get rid of it. You also must have good neurotransmitters for the body repair. And the second thing it needs is activation, and it needs a lot of it. So activation is an important component for the nerve to repair itself. In our 6-week recovery program, we recommend very specific exercises directed to the activation of the brain, the joints, the muscles, and the nerves to improve the neuroplastic behavior. Our goal is to reestablish communication between the brain, the nerves, and the feet. We learned in the early 80s the brain can change with proper stimulation. This is called neuroplasticity. So what is done for activation and repair? Well, we give specific exercises for your feet and legs, brain-based therapies, balance exercises, modalities to stimulate nerve repair, taping procedures, proper supplementation, and dietary recommendations, which includes a complete 28-day meal plan. For our really difficult cases, we also offer the option of purchasing a home unit, which helps to support and repair the nerves. This is a very specific current that has been clinically proven to be effective in the support of peripheral neuropathy. And this therapy is done daily to help reestablish the connection between the brain, the peripheral nerves, and the feet. Now, this will be yours to keep and use after the conclusion of our 6-week recovery program. So the rest of the program includes a muscle roller, a massager, the supplement Nerve Revive, videos on stretching, videos of how to do certain therapies to your feet, videos of how to tape your feet properly, and then the complete meal plan, which is a guide that will give you an outline of 28 days of good diet and lifestyle recommendations. So our approach is a little bit different from everybody else. We try and focus on the cause and not the symptoms. We provide diet and lifestyle recommendations, and then proper supplementation and nutritional support. Some key points that I want you to understand: it takes many different things to correct the problem. There is no magic bullet. You must address not only the structural, but the neurologic and metabolic problems to have success. Our peripheral neuropathy program is the most comprehensive and state-of-the-art